Good evening, I'm Michelle Miller. The toll in the West African Ebola outbreak passed a milestone today, surging past 10,000 cases, nearly half of them fatal. Of the 7 Americans who have contracted Ebola, all have survived. But now a third state, Illinois, has joined New York and New Jersey in imposing a mandatory 21-day quarantine on passengers who've had direct contact with Ebola patients overseas. And that has volunteer organizations worried, saying the new rules will discourage healthcare workers from traveling to places where their help is desperately needed. Yesterday, New Jersey isolated an American nurse who returned from Sierra Leone. She has tested negative for Ebola, and as Jericka Duncan tells us tonight, she hasn't had a positive experience.
Kaci Hickox describes her quarantine as disorganized and frightening. She details her experience in the Dallas Morning News. An official, quote, barked questions at me as if I was a criminal. Hickox says after disclosing she worked with Ebola patients in Sierra Leone, someone escorted her to a quarantine office at Newark Liberty International Airport. She goes on to say, my temperature was taken using a forehead scanner and it read 98. 3 hours passed, I was given a granola bar and some water. I was left alone in a room for another 3 hours. Hickox is now being kept in a tent outside a New Jersey hospital with nothing but her cell phone. This is not a situation I would wish on anyone, she says. I'm scared for those who will follow me. Lisa Baum is with the New York State Nurses Association.
The last thing we want to do is to have disincentives for healthcare workers to treat sick patients either here at home or in West Africa.
Hickox is the first patient quarantined after New York City doctor Craig Spencer tested positive for Ebola. Health officials say they've now visited and cleared every place Spencer went to before his confirmed diagnosis. CBS medical correspondent Dr. John LaPook spoke to New York City's health commissioner, Dr. Mary Bassett.
And you can imagine that people are understandably concerned. Maybe he should have just been quarantined for 21 days?
He did not have symptoms at that time. He had not yet had a fever. And when he had a fever, he absolutely immediately notified the public health authorities, and all the right actions were taken after that. And his temperature was not that high. He didn't say, let me wait and see if it goes up. He measured a temperature of 100.3 and he picked up the phone.
Kaci Hickox ends her article by saying, we need more healthcare workers to help fight the epidemic in West Africa. The U.S. must treat returning healthcare workers with dignity and humanity. And tonight, officials here at Bellevue Hospital report Dr. Craig Spencer has entered the next phase of illness and is having gastrointestinal symptoms. And Michelle, Spencer's fiance, who was also isolated here, has been released from the hospital under quarantine.
Jericka Duncan at Bellevue Hospital. Thank you.